Hello and welcome to Care Conversations, brought to you by Nurse Registry. This is your trusted space for straightforward and useful health topics that matter the most to you and your family. From managing chronic conditions to understanding what quality nursing care really looks like, we're here to empower you with knowledge that makes a difference. I'm glad you're here. Let's get started. Today, we're going to talk about something that affects hundreds of thousands of people every year: knee replacement recovery. If you're preparing for knee replacement surgery, or if you've already had the procedure and you're in those crucial first few weeks of recovery, this episode could literally be the difference between a smooth journey back to the activities you love and months of frustrating setbacks. Here's the thing about knee replacement recovery. It's not a passive process where you just wait for time to pass and hope that your knee magically gets better. Your new knee is an incredible piece of medical technology, so to speak, but it needs your active participation and the right kind of participation to reach its full potential. The truth is, even small missteps during recovery can set you back weeks or even months. Too many patients accidentally sabotage their own progress with well-meaning but misguided decisions. But here's the good news. Most of these recovery roadblocks are completely preventable once you know what to watch out for. So today, we're going to walk through the 5 mistakes people often make after their knee replacement surgery and, more importantly, exactly how to avoid them. Because your new knee is an investment in your future mobility. And like any investment, it needs the right care to pay off. Let's dive in. All right, let's start with the number 1 mistake. And honestly, this is probably the most common one: ignoring or inconsistently doing your prescribed physical therapy exercises. After knee replacement surgery, your doctor and physical therapist prescribe a very specific set of exercises. These aren't random movements they pull out of thin air. Each exercise is designed to restore strength, flexibility, and range of motion in your joint. And when you skip them, you're literally slowing down your own recovery and making it harder to return to your normal activities. Here's what physical therapy actually does. It helps prevent stiffness and muscle weakness. It supports proper healing. It improves joint stability. And according to experts, neglecting these sessions can lead to long-term limitations in knee function. Now, I understand why people skip their exercises. The first few weeks are hard. You're tired, you're uncomfortable, and maybe your knee is starting to feel a little bit better. So you think, I could skip today. But here's the problem. Some patients stop doing their exercises once the pain decreases. They think, I'm feeling better, so I must be done. But your knee still needs consistent activity to fully recover, even when it's feeling pretty good. Think of it this way. If you plant a tree and you water it diligently for a couple weeks, you can't just stop watering it because it hasn't died yet, right? It needs that consistent care to develop strong roots and grow properly. And your knee is the same way. Even short daily sessions make a difference. Patients who stay committed to their therapy, and I mean really committed, showing up every single day, they regain mobility faster and experience less discomfort over time. So here's your action step. Follow your structured rehabilitation plan diligently. Set a specific time each day for your exercises. Put it on your calendar like you would any other important event or activity, because this is not optional. It is foundational to your recovery. Okay, let's move on to mistake number 2, failing at pain management. Okay, let me be really honest with you. Like I said, the first few weeks after knee replacement surgery, it can be painful, pretty painful. And how you handle that pain can make or break your entire recovery. Here's what most patients don't realize. When you skip pain medications or you try to tough it out too early, you're not really just being brave. You're actually setting yourself up for a longer, more difficult healing process. Uncontrolled pain doesn't just feel terrible, it makes you avoid the movement and the physical therapy that your new knee desperately needs to function properly. Then we're right back to mistake one again, right? Your doctor prescribed that specific combination of medications, ice, and elevation for a reason. Think of pain management as the foundation that makes everything else possible. When your pain is under control, you can actually participate in rehab and you sleep better and therefore you heal faster. Now, I know what some of you might be thinking, but what about side effects? What if I become dependent on other people or medications? Now, these are valid concerns, but short-term monitored use of pain medication is generally safe. Your medication team knows what they're doing. They're the experts. They've prescribed medications in the right amount for the right length of time. Medical guidance ensures proper pain management without unnecessary risks. So here is your action step. Stick to the pain management plan that your healthcare team gave you. They've seen this recovery process hundreds of times before. They know how it works. Don't try to be a hero. Instead, take your medications as prescribed, use ice regularly, keep your leg elevated, and follow the plan. On to mistake 3, avoiding early knee movement. Now, this mistake is really counterintuitive because everything in your body is screaming at you, keep the knee still. I get it. And the last thing you want to do when your knee feels like it's been through a blender is start moving it around and bending it. But here's the truth. Staying still is actually your enemy right now. The window for getting your best range of motion back is surprisingly narrow. Those first 6 to 8 weeks are absolutely critical. If you wait too long to start moving, your knee might decide it likes being stiff. Scar tissue forms, muscles tighten up, and what should have been a straightforward recovery ends up becoming an uphill battle. Your new knee is like clay that's slowly hardening, or Play-Doh, whatever you had as a kid, right? You want to shape it into the right position while you still can. Those simple exercises your therapist showed you, the seated knee bends that feel impossible on day 3, they're not meant to be torture devices. They're insurance policies against spending months trying to coax flexibility back into a joint that's already made up its mind that it wants to stay stiff. Even something as basic as a slow walk down the hallway with your walker or cane is working magic that you can't see. Your knee is learning to move properly again, and every small movement now saves you from bigger struggles later. Therapists often recommend gradual increases in movement to avoid strain. Following these instructions reduces the risk of joint stiffness and supports better function over time. So consistent, safe practice of knee flexion, bending motion, right? These can make daily activities so much easier down the road. So the action step, right? Trust the process even when it doesn't feel natural yet. Keyword yet. Do those range of motion exercises your therapist prescribed. Start walking as soon as you're cleared to do so. Keep that knee moving gently and consistently from the very beginning. All right, here's where we need to talk about patience. Mistake 4, putting full weight on your knee too soon. This mistake comes from people who are actually feeling pretty good and want to speed things up. After knee replacement surgery, the joint and surrounding tissues need time to heal. The implant needs to integrate properly with your bone. Everything needs to settle and stabilize. Placing full weight on the knee too early can strain the implant and actually slow your recovery. It may also increase swelling and discomfort, which then, of course, makes everything harder. Again, yes, last mistake was not moving at all, but this mistake on the other side is don't go too hard too fast, right? Doctors usually recommend a gradual increase in weight bearing. The exact timeline depends on your specific condition, the type of surgery you had, and your surgeon's guidance. Some people use crutches or a walker for several weeks. The timeline is different for everyone. And I know it's frustrating. You see that walker in the corner and you think, I feel fine. I don't need that thing anymore. But ignoring these recommendations can lead to serious setbacks. Think of it like building a house. You wouldn't put the roof on before the walls are ready to support it, right? Same concept here. Your leg needs to be strong enough to handle your full weight before you ditch the assistive devices. Here's a key warning sign. If pain or swelling increases after you started adding more weight, that's your body telling you back off a little bit, okay? You should inform your healthcare provider right away. So here's the action step. Follow your rehabilitation plan closely. Use the assistive devices for as long as your medical team recommends, even if you feel like you don't need them anymore. Be patient. The gradual approach might feel slow, but it's protecting your investment and ensuring long-term success. And finally, let's talk about mistake number 5, skipping or delaying follow-up appointments with your surgeon. I get it. You're feeling better, your knee seems fine, you're busy. But the last thing you want to do is take time off work to sit in a doctor's office when it feels like everything's going fine. But here's the thing. Follow-up visits allow your surgeon to check your knee's healing progress and spot any issues early. Skipping these appointments is unfortunately one of the top mistakes, and it can delay treatment for problems that may affect your recovery. During these visits, your surgeon reviews x-rays, examines the joint, and assesses your range of motion. This helps ensure the implant is positioned correctly and the knee is healing as expected. Missing follow-ups can lead to undetected complications such as stiffness, infection, or implant loosening. And no one wants that. And some problems don't cause pain right away. Everything might feel fine, but something could be developing that will cause major issues down the line if not caught early. Surgeons also use these appointments to adjust medications, update activity guidelines, and coordinate with your physical therapy team. This keeps your recovery plan on track and tailored to your specific needs. So here's the action step. Schedule and attend all recommended follow-up visits, even if your knee feels fine. Actually, especially if your knee feels fine, because that means things are probably going well and you want to keep it that way. All right, so we've covered the 5 biggest mistakes. Now let's zoom out and talk about why all this matters so much. Like we said at the top, this is not a passive process where you just wait, sit back, and let your body fix itself. Your new knee needs your active participation to reach its full potential. This isn't about being perfect or pushing through excruciating pain. It's about understanding that every day you put in the work, whether that's doing your ankle pumps in bed or practicing going up the stairs, you are literally teaching your knee how to be a part of your body again. Skipping or delaying therapy can slow recovery and limit mobility. Your therapist will adjust exercises based on your progress and any discomfort. Clear communication about your pain levels and limitations ensures the program remains safe and effective. Following a consistent rehabilitation plan is one of the most important steps toward regaining normal function. Let me close with some thoughts on long-term care, because your recovery doesn't end at the 12-week mark. Protecting your replaced knee involves consistent movement, safe exercise habits, and avoiding strain that could damage the joint. Daily routines, activity choices, and body weight management all play a role in extending the life of your artificial joint. Regular, low-impact exercise helps keep the joint flexible and the muscles strong. Activities like walking, swimming, and cycling reduce stress on the knee while maintaining function. And here's something else to think about. Footwear matters. Shoes with good cushioning and support can improve your gait and reduce joint strain. Daily habits like avoiding prolonged sitting, using proper lifting techniques, and pacing your physical activity can help protect your knee for many years to come. And one more thing. If you need post-operative care at home after a knee replacement surgery, professional home nurses can make a huge difference. They know what's going on. They can report back to your team. Honestly, it is a world of peace of mind. Home nurses from Nurse Registry can help with wound care, mobility assistance, medication management, and monitoring for complications during that critical recovery period. Look, knee replacement recovery isn't easy. No one said it is. But avoiding these 5 common mistakes can dramatically improve your outcome. Your new knee represents hope for a more active, pain-free future. It's worth doing this recovery right. Show up for yourself every single day and trust your medical team. Be patient with the process and remember, consistency beats intensity every time. You've got this. Thank you for spending time with me today on Care Conversations. I hope this episode gave you valuable insights and practical takeaways that you can use. If you found this helpful, please subscribe and share it with someone who might benefit. Remember, quality care starts with quality information. And whether you're managing your own health or caring for a family member, you don't have to navigate alone. For more resources and expert nursing care, visit nurseregistry.com. But thank you so much for listening, and until next time, take care.